I contracted the coronavirus in the summer of 2020 in the process of taking care of people who were actually infected with the disease. That process was very difficult for me. I was actually out of work for a period of 2 weeks. Some of my symptoms were fever, chills, flu-like symptoms, body aches, things of that nature. And I had body aches, pains, joint pains, and I actually didn't fully recover. Even though I was able to go back to work after 2 weeks, I didn't fully recover from that process. It probably took about a period of 2 months. I'm a guy that likes to work out and exercise, and I eat healthy and clean. And it took me a while for me to actually get back in the gym and get back to my normal exercise routine.
In spite of any hesitation I might have had as a non-doctor, the doctor in me kicked in, and I've had both shots. I took the Moderna vaccine. Because I had antibodies, believe it or not, over the course of the last year, apparently I was infected and didn't know it. I took an antibody test. I had the antibodies. When I took my first shot, I had side effects. Now, side effects are a good thing, and that's another myth that people think. It's a bad thing. It gives me the flu. It gives me the COVID. It makes me sick. That sickness you feel is your immune system working. The headache, because you have more soldiers getting into the bloodstream, can cause headache. The chills, the fever, all these things, the muscle aches, all these things are signs that your immune system is robust and it's absolutely working. So I had a rough experience for the first time. I took some ibuprofen, some over-the-counter medications, took a nap. It lasted about 3 hours, took my nap, and I felt fine. The second time, which is the booster shot, Moderna again, I had the same type reaction, but it was a little bit over a longer period of time. But again, it went away within 1 to 2 days. So it's not anything that I would stray away from. There's no excuse. Just get your shot. If there's any questions, talk to your provider about it. And we have a plethora of information out here. We're not afraid of answering any question.
For me, the thing for me was that at one point I thought I would have had to been hospitalized. And I'm a person who eats clean foods. I eat lean meats. I eat a lot of vegetables, and I try to live my values and live the best possible way I can. But my worst day, I literally thought that I couldn't breathe. I was very short of breath, and I actually had to call my primary care physician because I'm privileged and I had that access. And he actually had to speak me through. We had to go over my list of my symptoms, and they were able to determine at that point, because the hospital systems were so overwhelmed with really, really sick, high-risk patients, for me to stay home. But at one point, I just felt completely drained, and it really felt like something detrimental was going to happen to me.
I am a community medicine doctor. I have a system of clinics. We at Access, we have 36 clinics, 47,000 patients. I'm health literacy, health education, and I'm on the science side the whole nine. I had the same hesitancy myself. I was afraid because it's the unknown. We're all afraid of the unknown. However, it's the unknown that allows us to progress, to grow, and in this instance, allows us to get back to some semblance of normal and have control. This vaccine is amazing. The two that are out now that are currently authorized are new technology that have never been seen before. Messenger RNA technology doesn't affect your genes. It doesn't affect anything. What it does is it programs your body to make the spikes, and then you make antibodies to the spikes, and your body thinks that it's seen the virus before. So if you encounter the virus, you won't get as sick. Your likelihood of being hospitalized and dying is significantly lower. It's something that can protect us all, but I understand the hesitancy because nobody wants to be the first person to test the length of the bungee cord.
Well, people who are skeptical of the virus in general, they actually don't know a few things, right? As somebody who was on the front line trying to manage and cope with patients who were dying from this every day, we saw that in the beginning, we were completely helpless. And the medicine has gotten way better. But for people who've actually been on the front lines and seen the devastation of this disease, we were so excited when the vaccination actually came forth. And the reason being is a couple of things. We looked at the studies, and what did the studies show? They showed that out of 22,000 people, you had 0 hospitalizations, 0 ICU admissions, and 0 death. Now, why is that so important? Because we know that if we did absolutely nothing, the mortality rate would be 3%. Now, for some people, 3% may seem like a very small number, but in medicine, we're never satisfied with that number, right? And in medicine, we know, if you think about it, in the US, there are over 300 million people. If 3% of the population dies from this disease, that's in excess of 9 million people. 9 million people. That's worse than any war that we've ever had on American soil. So people need to realize that this is a disease that we're actually at war with. And now that we have the vaccination available, it's very important for them to try to protect themselves from the enemy.
Yeah, one of the most common questions I've heard from members or patients is that they're concerned that they may have to pay something out of pocket for the COVID-19 vaccine that has become available. The good news is that the federal government has actually allocated money and paid for the vaccine itself, or the medication that is in the vial. They have actually paid for that themselves and are distributing it across the United States. So the vaccine itself is being paid for by the government. The other piece of that cost that may be associated is from the physical act of administering the vaccine or giving the shot, putting the shot into your arm. That cost is actually covered at 100% from all insurers, the majority of all insurers, including Medicaid, Medicare, and commercial insurers. There's only a very, very tiny portion of some medical insurance plans that may have a small cost associated, but the vast majority are covering all of that cost at 100%. Also, if you don't have insurance, the federal government has also allocated money to cover those people to get the vaccine without any money out of pocket. So there's a lot of frustration around how long we're having to wait to get the vaccine. So because of those phases, and every state can be slightly different, Louisiana has its own set of phases. The federal government has put out some guidelines. The best thing to do is to look at the Department of Health in your own state and see what your phases are. Louisiana has several phases that are outlined, so take a look at those phases and see where you fall. If you are currently in one of those phases, again, vaccines are being made available over time, so definitely look to that website. There are authorized facilities that are giving the vaccine, including health systems and some pharmacies. So if you're eligible now, start looking to be able to get that vaccine, talk to your healthcare provider, look at that list online. But it can take some time, like I said, because there are so many people that need it. It's taking time for everyone to be able to get a hold of it. If you're not eligible for the vaccine right now, rest assured in the future, everyone will be available to get the vaccine. It's just taking time to produce that many physical vaccines. What is most as important, what the absolute most important thing is that even if you have had the vaccine or you haven't had it, continue to do all of those same things that we've been doing: social distancing, wearing your mask, following the guidelines from your local and state government. Because what we really don't know is that if we've had the vaccine, we know that protects our own selves against getting sick, but we still don't know quite how that's going to affect people we may come in contact with that haven't had the vaccine. So we want to keep everybody safe. So we don't want to unnecessarily spread germs just because we've had the vaccine ourselves. So whenever you do finally get your vaccine, still wear your mask, still socially distance until we've gotten the all clear from health officials.
People hesitate to get the vaccine because, in my opinion, they're uneducated about it. They've taken the advice of people who know nothing about the vaccine. So I would challenge each of those people to find someone that they trust in their community, their doctor, a family member, or someone who has taken the shot, and to find out what effects that the shot has had on them.
One of the mantras of the 100 Black men in metropolitan Baton Rouge is what they see is what they will be. So it's very important for persons in the community to get the vaccine, because as older persons, younger persons in the community are looking to us for leadership. So as they see us actually going out getting the vaccines, our children, our grandchildren, they get into a habit of taking better care of themselves and being proactive with health care.
Well, I think there are a number of reasons why individuals in the minority community is not being vaccinated at the same rate. Part of it is there's a history of challenge that we have as people of color, where there have been studies and things done over the years that has really raised a level of reticence around being vaccinated. But it's about being educated. And I think it's a lack of education, a lack of awareness, and just general fear, because as humans, it is a challenge when this is so new and we're not sure exactly how to respond.
Some people say if I take the vaccine, I'm going to get COVID-19. That's just not true. Some people are afraid to take the shot because of the side effects. But if they ask people who have taken the shot, my mother took the shot and she's 82 and she didn't have any side effects at all. So I would just challenge people to just educate themselves and talk to people who have already taken the shot instead of listening to people who have not taken it.
Yes, I'm one of the persons who has received the vaccine already. I had the 2 shots. I came through it very well. I had very few side effects. I think the only side effect I had was I decided to take a nap, which is not normal for me. But there were no other side effects that were associated with it, which is why I do encourage persons to make the decision based upon their family and then go out and have the vaccine. Because many people suffer from diseases because they choose not to take advantage of things that are available to them. Not that they don't have access, but they choose not to take advantage of the access.
The moment that I am tapped on the shoulder to get the vaccine, I will be first in line. It is that important, not only for me on an individual basis, but I consider the impact that it has on the community. I believe it is important for me to be vaccinated for the health and safety of those who I engage with, my family members, friends, and others, and just the general community. If I'm vaccinated, it gives us all a much better opportunity of being or staying well.
I have not taken the vaccine yet. Next Thursday at my office, we're offering it to the entire staff. Because we're in healthcare, we're on the front line, so it has been made available to us. So we will take it next Thursday. I just want to challenge everybody, whenever it's time for you to take the vaccine, to take the vaccine. This is a worldwide disease that's out here, so we have to do our part in our community.
I've had the first shot. I had Moderna. Didn't have any real side effects. I was fortunate in that local clinic called me to say that they had me on a waiting list and that they had some people who didn't show up and they wanted to get the vaccine going. So my wife and I were able to show up and get the shot. I had a little soreness in my arm, but according to the paperwork that I read, that was to be expected. So it was really just like getting the flu shot, annual shot if you get them, when you were growing up as a kid. I do it again. I have to go back and get Part B or the second dose. And so I'm looking forward to it. It's the type of thing that I believe that I need to set an example for my family, my friends, and my community. So I'm willing to go out there and do it.
My advice to people who are skeptical of the disease, they have to keep one thing in mind. This is a disease that's extremely real. It's impacting a ton of people. And what people don't tend to realize is that not only are people dying, but you have a significant amount of long-term effects from this thing. You have people who are permanently debilitated. They're getting strokes. They're having heart attacks. They're permanently short of breath. They are having symptoms where, they're having side effects from stroke, like paralysis and hemiparesis, and things that just affect your quality of life in general. And nobody's talking about those patients who contract this virus, and even the ones who don't die, the ones who actually survive. Those are the impacts on society in general that we have to be concerned about, because somebody has to be able to step up and take care of people when they're no longer able to have their normal daily activities, or they're no longer able to proceed in their activities of daily living, which sometimes we can take for granted because our quality of lives can be good.
This is the light at the end of the tunnel, a very long roller coaster ride that's not been fun. The vaccine gives us an opportunity to have control of getting back to some semblance of normal life. In the Black and the Latino or Latinx community, it's of utmost importance because those are the people in our community that are most affected with the virus. At one point this last year, in April, our governor announced that 7 out of 10 bodies that were at the morgue looked like me. They were African American that had died from COVID-19. So it's serious, and it's a tool in our bag where we can all help in the fight to protect ourselves and each other.
As a member of the community, as an African American, I've heard all of the rumors and the stories that people have talked about. People tend to listen to their friends. It's always what they say as opposed to what the medical professionals say. So every medical professional that I talk to tells me that it's important to get the vaccine, that it's safe, and that it's healthy for our community to take. So I just think there's an overall distrust on the part of people from institutions. Unfortunately, we're coming off of a period in time where people have been conditioned to mistrust institutions. And as African Americans, we have a lot of reasons to distrust institutions. But in this case, we believe that the vaccine is safe and that we all should take part of it.
We have set up a testing program that we are taking into the communities. We went out and obtained funding from the National Institutes of Health to be able to conduct a testing program in underserved communities. We partnered with the Mayor's Healthy Baton Rouge initiative to be able to implement that. We're using saliva testing, and so this is where somebody just spits into a tube as opposed to the swab up your nose. And we think that that's going to be a little easier for people to do. It is free, and we expect to be able to deliver that test to about 2,000 people in various zip codes and underserved communities here in Baton Rouge.
Many of us have never lived through anything like this in our lifetimes. So one of the things that has come with that fear of a new pandemic and how to deal with it is learning how to deal with our existing medical conditions. Just because there is COVID-19 out there does not mean that people don't have diabetes or high blood pressure or heart disease, or that we may develop new problems during the pandemic. So some people have been so afraid of COVID-19 or going to the doctor's office that they've delayed care for their existing health problems, or they've put off care like their preventative health care, looking for existence of problems that they may have other than COVID-19. If you are hesitant about that, be rest assured that doctors' offices are taking the highest precautions to prevent spread of germs, not just from COVID-19, but all other things, including flu, cold, stomach viruses, all of that sort of thing. They're very used to that. So they're cleaning surfaces. They're keeping things very sterile in those environments. So the doctor's office is not a place to be afraid of. And people that they think have COVID-19, typically they're caring for those patients in a different area. So in general, you shouldn't be too afraid of going to the doctor's office. And if you are, again, reach out to those healthcare providers, ask them ahead of time, what are their protocols? Make sure you're wearing your mask, get comfortable with the process before you go. But if you haven't had your regular checkup, start looking to get that done, because waiting is not such a great idea because new things can pop up. Like I said, just because there's COVID-19 doesn't mean that other things don't exist.
As a doctor, I would recommend that you get as educated as possible. Understand that the vaccine is extremely safe. There were no shortcuts taken. I know it seemed like it was a short period of time, 10 months, but this technology has been around for a long time. Technology has been around for a long time, but we didn't have the resources necessarily to develop it to fruition because, first of all, 75,000 people weren't signing up for clinical trials. Secondly, we just didn't have the resources. Messenger RNA is very fragile. But what happened is, because of the pandemic, we had over 75,000 people volunteer for clinical trials to safely bring this vaccine to fruition. And then we had all of the resources in the world trying to find a way to help us all. So it's valid. Get the vaccine.
For people who are on the fence for getting the vaccination, this was my experience. I experienced arm soreness. And most of the people that I talk to, that is the most common side effect. Your arm will feel sore for a few days, but it's nothing that that's nothing that's unbearable. Number two, some people may feel like, they have symptoms of the flu, but actually that's not the virus itself. That's actually your body, that's your immune system. It's a normal sign of your immune system that's fighting, or getting prepared to deal with the real live virus. So if you do come in contact with it, or you do receive it in the future, what'll happen is you'll be much more prepared to deal with the impacts and the severity of the disease. And you're way less likely to perish from the disease, and you're way less likely to have long-term complications from the disease.
Well, according to the medical professionals that I talk to, it's important that we develop what they call herd immunity or community-wide immunity. We do that, the shot gives us antibodies. So the more people that build up those antibodies, the less virus transmission takes place. So, we should be mindful of the fact that many of us, people of color, are working in what they call essential jobs. We've got to be out there working. Many of us don't have the luxury of working from home. We're teachers. We're factory workers. We work in the post office. We're in service jobs where we have to interface with the public. So we have more exposure. So it's important to get out there and get the shot, build up the immunity, protect your family and friends. We just came off of Mardi Gras season, like no other. Mardi Gras 2022, I'm hoping will be better than Mardi Gras 2021. The only way that's going to happen is if we get the vaccine. and build up our community-wide immunity.
It's important that we all take this vaccine for the sake of our community and the world, because this isn't something that's just here in Baton Rouge. It's a worldwide pandemic, and we have to do our part to help rid this pandemic or make it go away. And the only way we can do that is by taking the vaccine.
I want to encourage everyone to be vaccinated because this is a worldwide crisis. I believe that the more we as individuals will commit ourselves to being vaccinated, it puts us in a position to not only be well individually, but also to help ensure that we can build herd immunity across the community. At Blue Cross and Blue Shield of Louisiana, our mission is to improve the health and lives of Louisianians. And so I'm a Louisianian, and so I have to do my part to be vaccinated, not only for me, but for those who are around me.
I think safety is a relative thing, and you have to weigh risk against not getting it. So when I think of why I want to encourage a person to feel safe about it, it's because at this point in time, there are more people who have died from not having it than who've died from having it. And to me, that swings the scale on the side of, let me do this. I also think that a person may want to do it because do it for your children, do it for your grandchildren. We all want to be here to see our children, our grandchildren grow up and be successful. This gives us a sporting chance at being here for them.
We need to be mindful of why we're encouraging people to get the vaccination. We're trying to prevent death, and we're trying to prevent long-term complications. Nobody's talking about the long-term complications of if you get the coronavirus. And what's happening is this: some people who survived the first onslaught, they're ending up with secondary complications. Some of those secondary complications can be things that, again, we take for granted: strokes, heart attacks, and permanent shortness of breath, which can minimize your quality of life. And nobody's talking about those significant things. So that's why it's extremely important for us to get the vaccination. And I would also like to say to the naysayers, we have now in the United States over 66 million people who've gotten vaccinated. Over 20 million people have gotten both shots of the vaccination. Of those 20 million people, go and look at the data and see how many of those people have actually died. So those are the type of things that we have to be able to take our emotions out of it and look at the numbers and see what the numbers show to improve and for us to get back to the normal, regular way that we all know life as we knew before.
I want to encourage everyone to feel safe in getting the vaccine. We all want to feel safe. We've never been in a more uncomfortable space in our lives. Everything that we know has been affected by the virus, and we felt helpless because we didn't feel like we had any way to fight back other than wearing our masks, washing our hands, and social distancing. I mean, I feel like a little kid, right? Wear your mask, wash your hands, social distance. But now we have science. We have the technology of science in our favor and in our bag that we can fight back. I take my shot to protect you and my family. You take your shot to protect you and your family. But the point is we're all protected. It's a collective effort, and it's something safe for all of us.